Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Our research-backed videos are engaging, easy to follow, and they help ease the daily challenges like agitation and anxiety so that you can focus on connection and joy. Available by subscription on mobile and TV apps, Zinnia makes every day a little bit easier. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Welcome to Medicare Moments. I'm Jim, and your host is Toni King. Hi, Toni.
How you doing, Jim? What's going on your side of town?
Just trying to keep it all together here for another Medicare Moments podcast. And it's really exciting because you bring such great information to our listeners. And I want to thank you for that, because I know every time people tune into the Medicare Moments podcast, they get lots of great information. Today, something that's close to a lot of people, losing employer benefits with dental and enrolling in Medicare. What do I do is the question from Tammy in Alvin, Texas, Toni.
People get confused about it because dental is so important. People think more on dental when they're retiring than they do their Medicare, and they don't realize how things are.
Tammy writes, Dear Toni, I will be eligible for Medicare in July and am now receiving cancer treatment. I am currently on my ex-employer's COBRA and searching for dental care when I go on Medicare in July. The only dental vision plans I am finding are in Medicare Advantage plans, but my cancer facility has advised me not to go in that direction because many Medicare Advantage plans are no longer accepted at their facility. Is there a dental plan that Medicare offers? Please advise. Tammy from Alvin, Texas, which, by the way, is the home of Nolan Ryan. But back to you.
I know. And one thing we need to let people know is that you and I pretty much live in the same area. And I am like an hour away from you. They cannot realize how big Houston, Texas is. I mean, we take up 5 counties.
What can we do about dental and this particular situation from Tammy, Toni?
Well, what I need to tell Tammy is that what's not covered by Medicare Part A and Part B is explained in the Medicare New Handbook. It explains what's not covered. Dental is not covered with Medicare, and it's explained on page 55 of the 2024 Medicare New Handbook. And it's amazing because Medicare does not cover everything. Not everything's covered. You have certain services that are covered under Medicare Part A and B, and there's things that you have to pay for, such as dental. Dental is not covered. Advantage plans do cover some dental, but you always want to make sure that you talk to your doctor to see if they are accepting that Medicare Advantage plan.
So are you saying that you can have Medicare A, B, and D perhaps, but you need to source other plans and other policies for dental and vision and other things such as that?
You can get dental plans, whether they're a discount dental plan or a true dental plan. You can have those, but they're not part of Medicare. Medicare does not cover dental at all. And that's since she's having problems, since Tammy is having problems and she's using cancer treatments, she wants to make sure that she gets the right plan. And people get sold something because they're looking for a dental plan. So if Tammy goes on a Medicare Advantage plan, she could lose her doctor. And that's not good. So you want to make sure that when you are getting dental plans, if you are in a Medicare Advantage plan, that it covers the services that you need, such as your doctor. So many plans have extra benefits, such as a fitness program, a gym, hearing, and dental services. So here is the services that original Medicare does not cover, and people do not realize. You don't get your glasses covered, long-term care, cosmetic surgery, hearing aids. Now they have concierge services. That's not covered under Medicare. You want to make sure that what you're doing, you want to be real careful. If you want to see all the different things that are covered, look on page 55 of the Medicare and You Handbook. Most of your dental care, original Medicare doesn't cover dental services unless it is a medical procedure, such as something that's happened through a heart or valve replacement, organ transplants, or cancer-related treatments. You have cancer of the mouth, the dental will be covered.
So it's not preventative dental care. It's dental care because you had something else impact your need for dentistry.
That's medical. That's medically necessary.
So what do you recommend for someone where Medicare does not cover dental?
Well, under Chapter 2 in my Medicare Survival Guide, we discuss everything that's under Medicare and what's covered and what's not covered. So when purchasing a dental plan, there's two different kind of plans. You got a traditional plan, which is a traditional health insurance plan or additional dental plan, and it takes care of your basics. If you got to get your teeth drilled, major procedures, those are true dental plans. And then you have a discount dental plans that give you a discount when you go to the dentist. Sit down with your dentist, find out what plans they accept. That's important to do. That's what I did with my dentist. And I got the right plan and I know how much I'm going to pay when I go to the dentist.
Having a daughter who is a dentist, and I do, you can talk to them and they are wide open. There's staffs at most offices. You can talk, explain your situations to them, and they'll come away with putting together something to help you in most cases, Toni.
That's right. And what people need to realize is that when they're looking at Advantage plans, because Advantage plans give you a little bit of extra, make sure you sit down with your doctor, especially if you have a health issue, such as what Tammy has because she has cancer. She may be going to MD Anderson. You want to make sure that your health care is taken care of first, then you look at everything else. That's important.
Healthcare is first. This is Medicare Moments. Toni King is your host, and we'll be back after this important message.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Welcome back to Medicare Moments with your host, Toni King. We're talking today about finding the right medical care for you first, followed by other procedures that you may want covered, such as dental or other cosmetic surgery, long-term care, what's not included, what you have to look out for. And Toni, we've addressed these in previous podcasts. In fact, we have a long-term care podcast that we did earlier, which you can find through seniorresource.com or tonysays.com. And we try to address these so that you're prepared in advance, because preparation is important, because like Toni says all the time with Medicare, what you don't know can hurt you, and you don't have any false expectations, right, Toni?
That's right. And you need to realize that as far as vision is concerned, cataract surgery is going to be covered under original Medicare or under a Medicare Advantage plan. Your cataracts, that is surgery. That's medical. That will be covered. You'll be taken care of. And that's really important to know that. And you want to take your time and make sure you pick the right plan for you that's going to meet your needs. Always talk to your doctor. Don't just let that person come in your house and sell you something. Make sure you know what you are getting and make sure your doctor is accepting the plan you're receiving. Don't you think that's important?
It's important. And it follows what you say, Toni, which is sit down with a piece of paper and write down things that are important to you. Talk to your family members. Make sure you have everything so you're not missing any points. And then look to fill what you need by Medicare. First of all, your health. As you said, your health is most important. and then look at the other things you may.
That's right. And I have a new course, which is the Confused About Medicare. It's a downloadable series. It has a cost to it, and it goes through everything in regards to Medicare, where you can personalize everything. Teaches you all about Medicare. Or we've got the Medicare Survival Guide Advanced Edition, which is a book that explains everything. You want to make Medicare yours.
And all of that information can be found at Toni's website, which is tonisays.com, TONISAYS.com. You can also see Toni's articles and hear her podcast at seniorresource.com. We thank them for partnering with us. And also, you can find her in newspapers all across the country. Give Toni a call, 832-519-8664. 832-519-8664. Write to Toni, and she loves to get emails. info@tonisays.com. info@tonisays.com. And Toni, I know you're looking forward to having people contact you.
Well, we have fun with it, and we learn. We have new articles that we can write by helping people with their situations. So I just want to tell you, Jim, thanks a lot. This was fun, and let's go help people. How's that sound?
That's what we do. That's what you do best, Toni. Thanks.
Okay. I'll see you later. Talk to you next week.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.